What if the single habit doctors, dietitians, and every wellness app on your phone tells you to do more of every single day, drink more water, drink more water, drink more water, was the exact same habit that has killed marathon runners, hospitalized soldiers, and sent perfectly healthy people into seizures? Sounds impossible, right? Water is supposed to be the one thing you genuinely cannot overdo. Except you can. And people have died finding that out the hard way. Today, we're talking about the dark side of the most trusted liquid on Earth. Water. The ultimate health symbol. It's in every fitness influencer's giant tumbler, every drink half your body weight in ounces infographic, every wellness routine that opens with, and obviously, stay hydrated. We've been told for years that more water solves more problems. Clearer skin, more energy, better digestion, weight loss, fewer headaches, just drink more. And to be fair, most of that advice exists for a good reason. Chronic dehydration is genuinely common and genuinely harmful. We are not here to tell you to stop drinking water. But here's what almost nobody mentions in that conversation. Water has a ceiling. A real, biological, measurable limit, and crossing it doesn't make you healthier. It can put you in a hospital bed. Today we're talking about water intoxication, a condition that sounds almost like a joke until you see what it's actually done to real people. Let's start with the biology, because once you understand the mechanism, everything else in this video will click into place. Your kidneys can only remove about 0.8 to 1.0 liters of water per hour. That's the ceiling. Drink slower than that, your kidneys keep pace, everything's fine. Drink faster than that, consistently, for a sustained period, and the water starts piling up faster than your body can clear it. Here's where it gets dangerous. When you flood your system with more water than your kidneys can clear, the sodium concentration in your blood drops. This dilution is called hyponatremia, and it triggers a chain of events that can become dangerous fast. Think of your blood sodium like the salt in a perfectly seasoned soup. Add too much plain water too fast, and you're not making the soup healthier, you're diluting it past the point where it still works the way it's supposed to. And the real danger isn't really happening in your blood. It's happening in your skull. When the fluid outside your brain cells becomes more diluted than the fluid inside them, water rushes into the cells to balance things out, and brain cells swell. Because the skull is rigid, there's no room to accommodate that swelling, which leads to increasing pressure and progressively severe neurological symptoms. Every other organ in your body has a little room to expand when it swells. Your brain, encased in solid bone, has none. Sodium is critical for nerve and muscle function, and when blood sodium drops too low, water gets pulled into your cells by osmosis, causing them to swell. Brain cells are especially vulnerable because the skull leaves no room for expansion. That's the entire dark side of water in one sentence. It's not poisonous. It's not toxic in the traditional sense. It just creates a pressure problem inside the one organ that has absolutely zero tolerance for pressure problems. Now let's talk about who this actually happens to, because the answer might surprise you. Most people assume water intoxication is some bizarre, freakishly rare event that could never happen to someone like them. The data tells a different story. A study of runners in the 2002 Boston Marathon found that 13% of the runners tested had hyponatremia at the finish line, and 0.6% had critical hyponatremia. 13% of marathon finishers. People who trained for months, who were arguably some of the healthiest, most disciplined athletes at the event. A 28-year-old woman died after the 2002 Boston Marathon as a result of this condition. She didn't collapse from dehydration. She collapsed from drinking too much water while running, faster than her stressed, exercising kidneys could possibly process it. And here's the detail that should genuinely unsettle anyone who's ever grabbed a sports drink mid-run thinking it was the safer choice. The study concluded that hyponatremia was just as likely to occur in runners who chose sports drinks as those who chose water. It's not just runners. Every summer in the United States, athletes die and suffer neurological complications from drinking too much water, and the U.S. Army has documented the same outcome in a percentage of its own trainees. Several military training cases and 3 confirmed deaths have occurred from overhydration, all associated with more than 5 liters, and usually 10 to 20 liters, of water intake within a few hours. Picture that. Soldiers, in peak physical condition, following hydration guidelines that were specifically designed to protect them, and the guidelines themselves became the danger. Here's the detail researchers found genuinely alarming. There seems to not be a single documented case of death resulting from sports-related dehydration in the medical literature. Meanwhile, athletes continue to die from drinking too much water nearly every year. Let that sink in. The thing we've spent decades warning athletes about, dehydration, has essentially 0 documented sports deaths attached to it. The thing nobody warns them about, overhydration, has a body count. Have you ever forced yourself to drink way more water than you actually wanted to, just because you felt like you should? Drop a comment. This habit is far more common than people realize. So how much water actually crosses the line? There isn't one universal magic number, because it depends on your body size, your sweat rate, your kidney function, and how fast you're drinking, but the research gives us some genuinely useful reference points. In some people, water intoxication symptoms can develop after drinking about a gallon, roughly 3 to 4 liters, of water over just an hour or 2. That's not an extreme, freakish amount. That's the kind of volume someone might drink if they're trying to flush out a hangover, pass a drug test, or compensate for a day of feeling dehydrated. There are documented cases of fatal water intoxication where the victim drank 7 liters in 3 hours or less. And under physical stress, the math gets even worse. During a marathon, the stress of the situation increases vasopressin levels, which can reduce the kidney's excretion capacity to as low as 100 milliliters per hour, meaning drinking 800 to 1000 milliliters per hour under those conditions can lead to a net water gain, even with considerable sweating. Translation: your body's emergency stress response, the same one triggered by intense exercise, can temporarily cripple your kidney's ability to process water at exactly the moment everyone around you is yelling, "Drink more water, you need to hydrate." It's a genuinely cruel biological irony. The advice that's correct 95% of the time becomes actively dangerous in exactly the situations where people follow it most aggressively. Here's a group that almost never gets mentioned in these conversations, and arguably should be talked about more. A condition called psychogenic polydipsia, most often seen in people with schizophrenia or other psychiatric disorders, involves compulsive water drinking that can reach dangerous volumes, sometimes well beyond what thirst dictates, exceeding the kidney's maximum excretion capacity day after day. Combined with certain medications, this becomes a chronic, ongoing risk rather than a single dramatic event. It's a sobering reminder that water intoxication isn't always a sudden marathon collapse. Sometimes it's a slow, repeated pattern hiding inside a mental health condition that has nothing to do with fitness at all. And there's one more group worth a direct, serious warning. Infants. Even small amounts of water can dilute a baby's blood sodium enough to cause seizures, coma, or permanent brain damage. A baby's kidneys are nowhere near developed enough to handle the same load an adult's can. Breast milk or formula should remain the primary fluid source, with small sips of water only introduced after 6 months alongside solid foods. Well-meaning parents giving their infant just a little extra water on a hot day are operating on an assumption that simply doesn't hold up for a body that small. So what's the actual, sensible takeaway here? Because this is not a video telling you to fear your water bottle. General guidelines suggest healthy adults need about 2.7 to 3.7 liters of total fluid per day, including water from food and other beverages, which works out to roughly 5 to 7 standard bottles for most people. It is difficult to drink too much water by accident, and this typically only happens as a result of overhydrating during sporting events, intense training, or specific medical and psychiatric conditions. For the average person going about an average day, your thirst mechanism is doing its job quietly and competently in the background, and there is no need to force down bottle after bottle out of some vague anxiety about hydration. You don't need to track this precisely. Your thirst mechanism works well for most situations. The danger zone is narrow and specific, large volumes, consumed rapidly, often during extreme exertion or under a medical or psychiatric condition that overrides normal thirst signals. The real lesson hiding inside this story isn't about water. It's about how even the most universally agreed upon health advice can have a hidden edge that nobody talks about, simply because the mainstream version of the advice has been repeated so many times that questioning it feels almost absurd. Water isn't dangerous. Drinking far more of it, far faster than your body can process, in the wrong circumstances, that's the actual story. And now you know it. If this changed how you think about chugging water before a workout or forcing down a gallon a day because an app told you to, share it with someone training for their next